Hi, good doc. How are you doing?
Oh, I'm doing great, Dr. Mars. I'm wonderful. Good to be with you again.
It's good to be with you as well. The last time we had a good time, and several individuals who have watched the broadcast the last time indicated they wanted for us to come back again. And
Oh, wonderful.
there's quite a bit that we didn't touch on, and quite a bit that we need to cover. And so it's so good to be back with you and to glean from your expertise. I am Ainsworth Keith Morris, and I have the great Dr. Francine Hernandez today, a chaplain, trainer, supervisor, educator, pastor, doctor, everything.
That's enough of the titles.
Oh, that's good. So, how have you been, Doc?
I've been doing great. I've been doing great. I am so thankful for the opportunity, first again, to be with you this
Mhm.
afternoon. But I'm thankful for the opportunity to have the different lives that God has allowed me to touch over the years I've been educator in clinical pastoral education. So I'm feeling grateful today.
Sure, sure. So, what have you been doing since the last time we were here together? Any travels, any trips, any board certifications? What are some of the things that you've been doing?
Well, as a matter of fact, I've started to write the second volume
Oh, wow.
of Use of Self. Because in the first volume, I dealt with mostly formation, getting to know who you are and how family system has affected who you are and how you show up in ministry.
Hmm.
But now I wanted to move it to the next step, application. Looking at how kind of transfers show up, projections. A lot of time we have a tendency to project our stuff on others and to help you to be aware how that projection and kind of transference might show up. And also looking at the false self and the real self.
Mm.
Because as Winnicott has said, and also Carl Jung has said, we have been forced to wear masks, and that false self has become so real to us that many times we don't know who we are anymore. So I'm
Wow.
going to look at those different elements of the self and how it shows up in pastoral's encounter, so you can be more aware of that. So that's what the second volume is going to be about, moving from formation to really application and how does it show up.
Tremendous. That is tremendous. That is tremendous. Do you have a projection time for that?
That's a good question. I paused this week because I was doing a lot, but I'm looking at perhaps early September.
Wow.
Mhm.
That's good. That is good. That is good. And the last time we spoke about several books that you have already written, we did talk. Let's see. We spoke about Cave Walker.
Mhm.
We spoke about the safety pin. We spoke about bring a chair, not a needle, and stay in your lane. And churches need clinicians. We all That's the same. Stay in your lane. And the newest one, which is the use of self in pastoral care. That's the latest one, and that's the one you're writing another volume on,
A volume two, yes.
volume two. And this one is available on Amazon, and the cost is still $9.99.
Still 9.99.
Still for the Kindle version and for the paperback version. That is tremendous. I I know that anyone who receives or purchases will be certainly blessed by it. So we want to continue the conversation. There are some individuals who are joining us. We want to welcome them online. Go ahead if you have any comments, any questions. Please place your questions or your comments. Doc will be willing to answer
Yes.
some of those questions as you place them there and respond to your comments. So you're welcome. We're so happy that you are here. And
Mhm.
if you're joining this broadcast after the live, presentation. You can still ask your questions, and we will respond in the chat so that you can have answers to your questions. We're delighted that you're joining with us
Thank you.
today.
Yeah.
So, Doc, uh,
Mhm.
let's ask a couple of questions. In your writing, you describe people as living books,
Mhm.
and a question that I want to ask is what changes when we stop trying to quickly label people and
Mhm.
instead learn to read their story with care?
First of all, Dr. Morris, one thing that I have learned over the years is that people are far more than
Hmm.
whatever their diagnosis might be,
Hmm.
whatever behavior that we observe on a person. Because words that they speak, the first thing they say is not really what's going on with them. And many times those words are a reaction to the person standing in front of them, but it's deeper than that. If
Hmm.
we stop to label a person by what they first say and fail to realize that they are a book, when you pick up a book, all you see is the cover, right? So, my contention is that when you see a person, all you are seeing is the cover. There's a whole lot more to that person than the cover of that book. And a lot of times, people who read books, they just read the cover, the first page, and skip all the way to the end of the book and say they've read the book, and you have not read the book. You only skimmed the surface. So if you label a person just by the cover, by what you see, you have failed to read the words, the chapters, the different spaces, the commas, and the exclamation points that book is filled with. You failed to get to know that person because you did not take the time to read them. And when we rush to label someone, we stop reading.
Hmm.
So, and when you begin to read the book, curiosity has a way of coming in. And I'm inviting those who are listening, when you meet people through different walks of life, stop labeling people.
Hmm.
Take time to read the book. Take time to look what might be beneath the cover. And in clinical pastoral education, I teach trainees to read the living human document. Because within that book, there are several experiences. And some of those experiences are woundedness.
Hmm.
Some of it is pain, betrayal. We had a case even this week. I can't go into any details, where the person was saying, "You're taking away my manhood."
Hmm.
And if you just look at that statement and get angry about whatever the situation might have been, and not try to see what does manhood mean to that person, why they
Hmm.
even chose such a word to explain what they was experiencing in that moment. So it's important to pause, and instead of asking a person. And one thing I was thinking about before we came on today, many times if we hear that a person is in the hospital or that they're sick, many times the first question that people ask is, what's wrong with them?
Hmm.
Because they want to label that person. They want to see them through their diagnosis or through their illness, and not inviting people to pause and begin to wonder what's happening. Because disease, I tell trainees all the time, the disease is what the medical doctors contend with or deal with or make a
Hmm.
diagnosis or a prognosis. But we as chaplains, we don't deal with diseases. We deal with the illness. And the illness is,
Hmm.
how does that thing affect their lives? So if you're going to read the book, you got to pause. You got to bring a chair
Yeah.
and
Yeah.
listen on a deeper way.
Let me drill down on that because books are written in different ways. You have the autobiography, and then you have individuals who are authors of different stories, narratives. Um, what would you tell a trainee as it relates to understanding what was written or who wrote what was written, and why should they slow down?
Because people are different. People are different. You have different cultures, and people are affected by their cultures. One person may show up and get angry about one thing that another person is cool about. So
Hmm.
you can't make a judgment on that. You have to know their culture. When you slow down and read the book, when I say read the book, Don't just skim through the chapters. You gotta read it word by word.
Yeah.
Because words matter. And
Yeah.
in different culture, words matter. If I was talking to a person from, let's say from the Caribbean about what their life was like, they may say it's like a game of soccer.
Hmm.
But in America, we're going to basketball
Oh,
or
yeah.
football. So
Yeah.
we got to be able to listen to the words. What are the words they are using? And if you don't slow down, you'll skip over the paragraphs of their lives. So I said, slow down and read it word by word. Take time to listen.
Yeah.
I hope I answered your question
I
more.
think you did. One of your, I think, former trainees, Dane L. Fletcher.
Yes.
Dane is
Hi,
asking,
Dane.
uh, he's asking a question.
Okay.
Thanks, Dr. H and Dr. AKM. How do I know how to literate? Am I to read people, and should I not be aware of how my own limitations as I attempt to read?
Oh, Dane, you own it. You own it. And that's why it's important. If you read any of my books, I always invite the readers. Learn how to read yourself first.
Mm,
Don't go now. I know in kindergarten, it's pedagogical learning. The teacher pour everything into us, and we learn the ABCs. And I remember my first book, C Scott. What is it? C Spot. The dog was named Spot. C Spot Run. So we learn how to read from my teacher. That's pedagogical. But as adults, I'm inviting you to learn how to read yourself. And you're right, Dane. We need to be aware of our own limitations, aware of our own family system. We need to be aware of how our life story has impacted us before we can go and read another book. And when you're reading that book, dare not compare yourself to that person who's in front of you. So you are aware, be aware of your limitation, because there are some books you may not want to read because they may bring up your stuff. When I say bring up your stuff, your own past might get triggered. So
yeah.
be aware of yourself. And when you are aware of yourself, you know when to pull back and say, this is my limitation. Let me call Dr. Mars to come and visit with this person because I have gotten to my limitation. And it's okay to refer.
Yeah.
I hope I answered your question, Pastor Dane.
Yeah, I think Dane would be happy. If not, Dane, go ahead and let us know. So some people, you compare them as hardcover books
Mm-hmm.
that are difficult to open, while others, they seem like soft cover books,
Mm-hmm.
easily opened.
Mm-hmm.
What should we remember about someone's story in either hard to access or almost too easy to hear?
Mm-hmm. When it comes to the hardcover and soft covers, a lot of people want that hardcover. Some want the soft cover, and some want a
Mhm.
Kindle. Some, when I was writing my book, is it in audio? They want
Yeah,
different kinds of books, right? So
yeah,
I mainly had to extend some of the words I've used in the book. But the hardcover, people have learned they have this strong veneer. It's protective, so they show up hard. They're not easy to read. We have a person I know, even in my church, people has come to me and said, it's hard to read her because she show up hard
yeah,
because things have happened in her life. They have caused her to put up this protective image. And so if you try to, when you first meet with them and you're trying to engage them, don't get discouraged because they have spent years putting up this hard cover. And so take time. Same thing as we talk about the living human document. Take time to read them. Pause with people. The hardcover is protection. And if you move that
mm,
protection too soon, a whole flood may come running out at you. So you want to take time. Don't move away, because you walk into a room and the patient says, I don't want to talk. I don't feel like talking. And sometimes rejection can come in. And remember, they're not rejecting you. They don't know you. You
hmm,
just showed up. And so that hardcover is that person who has spent years in a protective mode. They've been hurt in their past. And they have determined, I won't be hurt again. And so when you're talking to them, it's going to take patience.
yeah. What kind of damage can be done if a chaplain does not spend the time to look at hardcover, soft cover?
Okay. If let's go back to the person who said, I don't want to talk to you. And you say, okay, I don't want to talk to you. Now, sometimes chaplains can get in their own feelings and they have to be careful about that. You have to be professional at all times.
Yeah.
If you, the person can feel further rejection. They've already taken time to put this hard cover because people have hurt them in the past. And now because you move too fast and you don't want to be bothered with them because their hard cover is there, you just add it on to their pain.
Mm.
Pause with people. So I understand maybe just not now it's not the right time. You don't feel like talking, and it's okay. Let them know you respect their rights to say, I don't want to talk right now. I never forget, Dr. Morris. I was on the floors and I visited this patient. Well, I was going to visit this patient. You know, my happy self going down the corridor like everything's going to be nice. And I went to the patient room. Good afternoon. My last name used to be Angel. So I said, good afternoon. I'm Chaplain Angel. I don't want to see a chaplain. Get out of my room. You know, now, let me be honest. I said, okay, that's just less people for me to see. I said, okay, now I just backed away, you know. But the next day, I was passing by the same room that seemed to be a hardcover, and I should have paused and said, I should have said a little more. Looking back in retrospect, it's okay. You don't want to talk, it's okay. And wish them a nice day. But in retrospect, that's what I should have done in retrospect. But the next day, I already knew. She told me yesterday it was a hardcover. She didn't want to talk. So I'm just passing by her room. Her door was open. Excuse me, Chaplain. Chaplain, come in. I'm trying to figure out what's going on here.
Yeah.
She was ready to talk. And she shared that yesterday she had gotten a certain diagnosis and she didn't want to talk to anyone. But now that she has had time to reflect on it, she was ready to talk. Now, see, if I had to pass by because it was a hardcover where she didn't want to talk yesterday, and I'm going to treat her the same way, I would have damaged her even further. And so at that point, she was ready to talk. And people are that way. Sometimes the hardcover is there because they don't feel you're going to take the time to listen.
Yeah.
No one has done it in the past. So why would you be any different? And when you pause and say, it's okay, I come back another time. Maybe then you want to talk with me. You know, and there's a metaphor that was used in Robert Dijkstra book. It's deal with the clown. You know, sometimes you got to be humorous with people. Okay, you know, sometimes I don't want to talk to me either. I mean, really,
Yeah.
you gotta find a way to be humorous.
Yes.
You know, and don't get into your feelings thinking it's about you. It's not about you. It's always about the living human document who you are trying to engage. And then the soft cover, that person who just ready to talk. You know, they want to talk. They need to talk. They need to share their pain, their woundedness, their brokenness. But don't be fooled by that. Sometimes even soft covers can be ready to spill over and share a whole lot. And if you don't watch it, you'll stay on the surface of that because you're so happy they're ready to engage. But pause and say, I'm just curious. You're sharing so much. What gives you the courage to share so much right now? Be curious. I mean, I love Columbo. I love Columbo.
Yes,
Columbo, I watched Columbo. Sometime now I go and watch the reruns. He always scratching his head and say, one more thing. I always remember that one more thing. Even with the soft covers and the hard covers.
Yes. Yes. It seems to me, as I listen to you, that this practice, this principle can be used not just for chaplains or caregivers, but in everyday life. Do you agree with that?
Oh, yes, I agree with that. Because people ask me, even in our groups, you may have heard them in your group, Dr. Morris, they'll say, well, I put on my chaplaincy hat. Saying, really? If you're a mother, do you put on your mother hat? If you're a father, do you put on your father hat? You're just a father. You're just a mother. You know what I mean?
Yes, yes.
You know, so if you're a chaplain, even as a pastor, you just become more clinical.
Yeah.
And people will respect you more. You don't put it on. It's just who you are. It's who you become. You want, and once people feel heard, Maya Angelou says, people may forget what you said, but they will never forget how you made them feel.
Yeah.
And so when you become that clinical person who really about listening on a deeper level, whether it's a hardcover, a soft cover, hey, if it's audio or Kindle, when you're willing to listen, and in my book there, and we'll get to it at some point, bring a chair, not a needle.
Yeah.
When you can just sit there and listen, you'd be surprised the gift that you will give that person. They don't want you to fix it. Just listen.
And talk about listen. You mentioned not only listening to words, but to pauses, silence, tears, and what is not being said. What would you say are some of the everyday signs that a person may be saying more than their words reveal?
Yes, watch for body language. After the person says something to you, watch for their body language. Because remember, you're reading a book, not just the words. You're reading the nonverbal and even the paraverbal. The paraverbal is the tone that they are saying it in. So once the words leave their mouths, listen to what happened to their body. Their body speaks volume. Listen to the tone they're saying it in. Listening, when we come to active listening, we have to observe that person wholly. A lot of times we get caught up in the words they are saying, and the words, what's beneath? If a tear fall, sometimes we ignore the tear. We had a case even this week where the person started to shed tears, and they moved beyond the tears as if the tears didn't matter. Tears speak louder than words could ever speak. And so it's important if you're with a person, noticing the body language. If a tear starts to fall, please pause and engage them. I notice you are crying. You want to say more about your tears? Because the tears have words.
Yeah.
Yeah.
Yeah. Tears. Let's talk about tears for a moment, because I think a sensitive moment is when people start crying. And you wrote that one of those occasions where we can misstep is even in those moments of tears. I think you alluded to the fact that even sometimes handing someone tissues can interrupt their story. Could you say a little bit more on that? What are some of the things that we intentionally do that will block a person's story from coming forward?
Thank you for that question. Because when someone begins to cry, our instinct is to stop the tears. Think about it. They are crying. They are releasing themselves. And our instinct is to stop them from releasing themselves. That's what we're doing. We're stopping them because we don't want. Now I know on the surface we don't want to see people hurt.
Yeah.
But they're crying. That's a release. And so you give tissues right away. But what I learned in psychology would back me up is that it's our own discomfort with tears.
Wow.
So when you give a person a tissue, what you are saying, stop your tears. Stop crying. We don't want to see you release. Now, I know you're not saying it in words, but your action of handing them a tissue is saying, stop crying.
Wow.
And they're releasing themselves. Let them cry. Let the tears fall. If you just need to hand them a tissue, no, don't hand it to them. Put it beside them. Let them decide when they want to stop releasing. Let them decide when they want to stop crying. Don't you decide that. That's not your decision. So if you can remember this, the next time you see a person crying and you reach for a box of tissue, what you have just said, I don't want you to release. I want you to stop.
What would you advise a chaplain? Should a chaplain feel comfortable leaving while someone is crying, or should they remain until the person stops?
Don't leave while I'm releasing. Because I said don't hand the tissue, doesn't mean you have to dismiss yourself, right? No, no. When a person starts to cry, first of all, it speaks of their vulnerability. That I don't mind being open. My pain is present with me, and I need to release this pent up energy behind this pain. So if you give me tissue, you're stopping that release. Don't walk away. Stand there. Silence is presence. It says that I can stand there while you release. I can give you the time to release. Oh my God. Can you imagine the gift that is that I can start crying and you don't have me tissue. You just stand there and listen. That's a gift. That's a gift. So please, if you're listening, let's stop handing people tissue. Don't stop their release. Don't stop them from crying. Sometimes I'm in places and I see a person run to get a box of tissue. Oh, I just cringe on the inside.
Yeah.
I can't say anything because I don't have the authority in that place to say it. But I really want to say, please come to CPE. Please, please, I want to give them an application to come to CPE because you don't realize what you're doing. It's unconscious. You don't mean any harm on the conscious level, but on the unconscious level, you're really taking care of your own discomfort.
But what if the chaplain feels like crying
Well, while they're in the midst.
while they're in the midst of the person crying?
Okay, you're a Christian, right? You are a believer, right? We have a model for that. We have a model.
I said, Jesus?
There's nothing wrong. Jesus wept.
Oh, right.
He didn't just cry now. There's a difference between crying and weeping. Jesus wept.
Yes.
So you have a model. Sometimes you're with people and you are touched by their tears. But I want you to pause even that during that time. Because you have to ask yourself, why am I crying? Why am I crying? If a person start crying, why am I crying? Because it can't be about what they're crying about. That's their situation. So evidently it touched something deep in you. Sometimes we have tears within us that we have never cried. And when you're with a person who is feeling free enough, vulnerable enough to cry, somehow it gives you permission to lift the tears, to let them go that you have not cried for yourself. Now, sometimes it's just compassion. You're with them and you want to cry. Let me give you a story. At a hospital years ago, I was going to have lunch with one of the trainees. And we had to pass by the area where people take bodies to the morgue in the hospital. And all of a sudden, she stopped and just started crying. I said, excuse me. I use it for an education moment. What are you crying for? You don't even know this person. This person could have been like Charles Manson. They could have just killed the whole household. You don't know who they are, but here you are crying about somebody you don't even know. Where are these tears coming from? You always have to ask yourself, even if you're crying in the midst of another person who's crying, what are my tears speaking? Your tears are saying something to you.
Yeah. 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 Yeah.
Yes. I see Dr. Harriet saying unresolved grief. Yes. Unresolved in yourself. Right. And yeah, thank you. Dr. Harriet is one of my colleagues who's in the process of writing as well. Yeah.
That's
It's
tremendous.
unresolved.
Yeah. So for that chaplain in that moment, that chaplain needs a chaplain.
Yeah. In that moment, that chaplain just might need a chaplain.
Thank you so much. Listen, for those of you who are on, we're once again welcoming you. We're so happy that you're joining with us as we have this conversation. I'm delighted to be speaking with Dr. Francine Hernandez. Dr. Hernandez just released the book, The Use of Self, and you want to ensure that you get a copy of that book. It's on Amazon. The Use of Self in Pastoral Care, a Psychodynamic Primer for CPE Trainees. It's there. You can pick up your copy. And Doc, you've been so insightful. A lot of individuals are making comments online. You may know some of them. Let me go ahead and put up some of these comments that are up here. I think Dr. Dane responded and appreciated your response. I said, thanks for continuing to open my eyes. You had Chanel saying amen. Dane again saying, thanks for continuing to open my eyes. I appreciate your response. And we have Julia Russell. Good afternoon. Thanks. You smile. You know these individuals.
Yeah, yes, I know. Yeah, I worked with Reverend Russell for years, and we did women retreats in New York, and she was one of the facilitators. Powerful woman of God.
Good shout out. And Deshaun Suggs.
That's my nephew. That's my nephew. Let me just say something to him, but he may get me later. He works for a funeral home. He's been doing that for years. And I want to appreciate what he's just said. That they stand there with the box of tissue, but they don't just give it to them. You know, if they decide to grab one, they can. And that's a good model. Let that person decide, because when they have lost someone, they want to cry. They want to release those tears, the pain, the grief that they are experiencing.
Tremendous. So we welcome all of you who are here. We appreciate you being here. Just go ahead, give us some more questions. Doc would be more than happy to answer those questions. There's a story, Doc, that you gave in the maternity ward. And the mother said, it's my fault. But the deeper issue is a long history of carrying blame. How can we learn to hear the pain underneath someone's first words, the first words?
Yeah. I remember that mother very vividly. It was years ago. The nurses said she was sad all the time, and she was blaming herself, even though the doctor said it was not her fault. And quite poised. I mean, a beautiful woman. You know how sometimes in the hospital they give you these gowns to wear, or they give you hospital clothing, different. No. Her hair was in place. Everything was in place. Quite poised. But she said, it's my fault. And I wonder with her where those words come from. My fault. Even at that time, even she felt her husband was blaming her that the baby had problems. And as I talked with her and engaged her, I discovered that in her family history, she was constantly blamed for other stuff that she did not do. It's like they call it male couple. Always my fault. I am the wrong person. And as I was in her room talking to her, what do you mean? Tell me what those words means to you. I invited her for a deeper exploration. It's my fault. And that's how I got into her story about blaming herself, that it was her fault. And if we are not careful, we will say, okay, it's your fault. Let's talk about it. But now it was more than that. What was those words covering up? And if we move too fast as a chaplain, we won't give them the opportunity to pause and see where the words are coming from. It was amazing. She was able to talk about her own family system of being blamed all the time. So now when something occurred, naturally, it's my fault. I did it.
Yeah.
And her baby, to even take the blame for her baby being sick, she even went to a story about, I'm not sure if I put it in the book or not, but she talked about she had permed her hair during that time, and maybe some of the chemicals could have gotten into it. And the doctor told her that did not happen. But because she had built an ethos around always being the person at fault, that when the baby was sick, naturally it was her fault.
Yeah.
But we were able to talk about that and move to a sense of empowerment when she discovered the genesis of even talking about it's my fault.
This leads me to another question, and that is, because you're listening to more than the words, the surface. It seems to me that your visit with a client, a patient, cannot be a fixed time. How do you advise trainees as it relates to the time they spend with clients?
That's a very good question, because a lot of new trainees ask me the same question. I'm going to answer you, but I wouldn't answer them. They ask, well, how long do we spend? I would not. I'm not a person who dispense answers. I like to explore with people. They say, how long do we spend with the patient? I said, tell you what, go visit the patient, bring me your case, and let's see how long you spend with them. I don't just give them answers, because the time you spend with the patient, there is interpretation that needs to be made. If you go into a room and say you spend 5 minutes with patient A, and then patient B, you spent 45 minutes. That's 40 more minutes. What was going on in that time? And so there is no time limit for how much you spend with the patient. But what I do say is, you spend time long enough to identify the pastoral issue and to offer an adequate pastoral intervention. Now, I can't tell you how long that's going to take, but you go and do it and bring it back, and we'll discover if you stay too long. Because sometimes, I'm going to be honest, and I probably should make this confession, but I hope I don't have any present trainees on here today. When I wouldn't do it now, but when I was a young trainee just taking CPE, I was tired. I was tired. When I get into that room, but they were watching one of my favorite soap operas. This is confession time now.
Yes.
I sat down. This is going to be a long conversation. This is a 30-minute soap opera, and this is going to take us at least 35 minutes for me to process with this patient. And so I wouldn't do that now, so don't do that. But the time limit is predicated on what the pastoral issues are. Because the person just told you, I met a person who was crying, and I said, well, say more about your tears. Because they had a pretty good diagnosis in the hospital. They said, well, my husband just died last week. Now, I have to spend time now to explore their grief. And then when it comes to exploring their grief, I need to know what stage they're in. That's why it's so important to know the stages of grief. Every trainee worth their salt in CPE need to know what are the stages of grief. Elizabeth Kubler-Ross gives us 5 stages. Of course, David Kessler added a couple more stages to that. But the first stage is denial. For those who don't know it, you can write it down. The first stage is denial. People denying that, Then the next stage is anger. Then once they get through anger, bargaining, asking God for more time for themselves or for their loved one. And then they move to a place of a depression. This is what it is. And the last stage is acceptance. Of course, David Kessler added on meaning and refunctioning again. How do you move past that? So when you're with the person who is grieving, the first task of the chaplain is to discover what stage of grief they're in. And the only way to get that is to take time to bring a chair and to explore the meaning of the tears. And it will come out during that conversation.
Yeah. You mentioned a couple of times, what's the pastoral issue? For someone who is not a chaplain, someone who is not into caregiving, pastoral work, explain the difference, because people may have several things going on. How do you get to that issue, that pastoral issue?
Yeah. The pastoral issues are different from medical issues. If a person say, if you go and visit with the person and they said that they're not feeling well, they're in the hospital, they just saw the doctor. And if your first question is, what did the doctor say? Then I'm wondering, you're not a doctor. What difference is it going to make? Are you going to be able to give them a prognosis or a diagnosis? You're not a doctor. You don't have, I have a DSM over here. It's a diagnostic statistical manual that has every disease you can think of and what the features might be. But I'm not skilled to do it. I'm not. Thank you, Dr. Woos. You got to listen for the echo, right? So I'm not skilled to do that, right? So I'm not listening for the medical issues. I'm not going to even get into the medical issues. The pastoral issues is, how is this thing affecting their lives? Now that I have the diagnosis, I feel that God has abandoned me.
Mm.
That's the pastoral issue, abandonment. And that's what you deal with, loneliness. Uh, they may feel disappointed. They may feel frustrated. They may feel overwhelmed. It's the emotional vortex. How is this thing affecting them emotionally, even psychologically? Now, I don't mean you're a psychologist, but if anger is coming in, that's affecting the psyche. So anger, when a person says, I'm just angry right now, don't get caught up in the anger. Because anger, as I think I may have said in the last segment that we did, anger is a secondary emotion. What is the primary emotion? Usually it's hurt. So you want to explore the echo beneath the anger, which is hurt. So you want to explore that. So when we say pastoral issues, we're talking about the emotional vortex, how they are being affected by whatever disease, whatever suffering that they are dealing with.
That is tremendous. Now, a lot of caregivers, a lot of pastors, a lot of individuals who share with, say, people who are not well in the hospital or stuff like that, they go in and they hear the first thing, the doctor said this about me. What's I don't know if I should say what's the danger in just dealing with that initial response from that person. What's the danger? I like to use that word. What's the danger?
Okay. If you're not careful, if you get stuck on the first thing they say, I tell you what it's like. Let me give you an example, and that might help. If you're reading a book
Mm-hmm.
and you read the first thing that is said in the book and said, this is what the book is about. Have you watched a movie and you all of a sudden you got a twist?
Yeah.
You say, oh my God, where did that come from? I never saw that coming. That's because you didn't watch the whole movie or you didn't read the whole book.
Mm-hmm.
So the danger is missing what is really going on with that person. You cannot get stopped or wait for the first person. I mean, listen to the first thing they say and you run with that. You can't do that. I mean, I was watching the movie the other day and when I saw the ending, I was shocked beyond measure. And that's what happened. It's a danger zone because you never get a chance to discover what might be really going on with that person if you get stuck on the first thing that they say. Read the whole book.
Yeah. Yeah. Read the whole book. Here's a comment from Robert Allen Angel.
Mm-hmm.
This is good because sometimes, as pastors of prototypical churches, we try to minister to issues that we are not trained for versus steering members in the direction of getting proper assistance. It's certainly not one size fits all.
Yes, I want to respond to that. That's he didn't put his title. That's Bishop Robert Allen Angel. He and I, he's my ex, believe not, my ex brother in love. We're still connected. We still maintain a relationship. And I appreciate that statement. I would listen to a preacher the other day, a Bishop Angel, who was talking about too many times pastors get caught up in, let me see if I can find this. I know you already had it up, but I need to pull it out anyway. Too many times the pastor get caught up in doing things that they are not equipped to do.
Mm-hmm.
Bam, stay in your lane.
Wow.
That's why I wrote it. Stay in your lane. Churches need clinicians. It's important for pastors to remember that you're not a one-all fix-all. Just like you wouldn't, if a person in your church needed heart surgery, are you going to set up an operation room in the church? You're not going to do that. Why? It's not in your lane.
That's true.
Right?
That's true. That's true.
Yeah. If one of your members needed a designer suit, You gonna set up a little tailor room in your no? Let them go to a tailor and get that suit. Let them go to the doctor to get that operation. Well, when it comes to the ailments that happen to people, sometimes what they are dealing with far exceed your scope of practice. It does not say something is wrong with you. No, 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 no. You're not a surgeon. You're not a therapist. Let them go and get a therapist. Let them go and talk to somebody, because sometimes it's deep rooted stuff in them that happened to them as a child. They could have been abused, and now somebody walked in the church and they got triggered. You can't handle that.
Yeah. Yeah.
Send them to a therapist.
Wow. Thank you. Thank you, Bishop. Is it Bishop? Bishop, Bishop Robert Allen Angel.
Mm-hmm.
Thank you for joining us, and thank you for all those who are making comments. Julia and Evangelist Melissa Suggs. Thank you so much for joining with us. Doc, we just about run out of time. Can you imagine? Can you imagine that?
Wow.
But can you share a couple of examples where trainees missed the pain because a person on the surface appeared strong, polite, or in control? Have you ever? I'm sure you have over all these years. Share a couple of examples, and what should we look out for?
Yeah, be really careful about a patient can share something and hold on a second. I want to get your question because I have an example I want to give you. Give me your question. Kind of summarize your question again.
Have you ever come across issues where trainees, they missed dealing with the pastoral issue because somebody appeared strong and they in control, or everything is going well?
Can I give you an example of something that happened in your group you may have forgotten? I think this might, if this does not answer your question, I can give you another example.
Good.
Do you remember the person shared that they went to visit a member of it could have been before you, Dr. Morris, but I think you were there. They went to visit someone, and the lady had a terminal illness, and they kind of talked to her and prayed with her and sung a few songs for her, and then they got ready to leave because they thought she was okay because she's strong. Now this was a twist in the story, and one other person turned back and asked her, "Are you okay?" And she said, "Really, I really am okay. But the problem is not me. It's my husband in the back room."
Wow.
He's the one who needs someone. He's the one who's dealing with it. They forgot all about it. So when you visit with people, if you visit long enough, if they had really visited long enough, they would have engaged her to see how she was doing. They would have engaged her family support system, and they would have gotten that.
Yeah.
But they just came in to do what they do. And I think that's a danger, even in chaplaincy, even in pastoring. You come in with your own agenda. I'm going to pray with them, and I'm going to lead them a scripture and encourage them. And we're going on to the next person. And you miss what's really happening, not only in the person, but also what's happening in their home.
Yeah.
I think if we just pause long enough to be with people. Don't rush. Remove this anxious presence that you got to do something. You don't have to do something. You got to be something.
Yeah.
If we can shift from doing to being, that's another gift you will give the person who you just went to see, or you said you were going to spend some time with them.
Doing and being. Talk a little bit more about doing and being, because I think for people who are driven by numbers or the desire to report, I did this, I visited this person, I went here, they want to report to the church, I visited so many people, I want, Talk about doing and being and the meaning with each.
Yeah. See, doing is, you talk about numbers. Doing is always external. When you're just doing something. I come to see you. I come to talk with you. Just doing. You doing most of the talking. When I see a case presentation
Mm,
where the chaplain has done most of the talking, they are just doing.
mm,
When you are being, you have positioned yourself to listen, and the patient or the client or the parishioner, they're doing most of the talking. And all you're doing, you're just exploring. It's like Paul Dykstra in his book, he talked about the ascetic witness. You are a witness. They're driving the car. You're in the car. Well, now you got some people who you got backseat drivers. So I'm not talking about the backseat drivers. But when you're in a car and the person is driving, you're just on the passenger side. They're doing the drive. They're taking you through the scenic route. You are just a witness of what you're seeing. So when you are being, you're more of a witness to the pain. You're a witness to the way they express themselves. So when you are in the position of being, you're not doing the talking. You are doing the listening. Listening costs something.
mm.
Because now you're not just listening to the words, as I said earlier, you're listening to the body. You're listening to the echoes beneath the words. It's a big difference about doing. And let me not say most, many pastors and ministers and chaplains, we are about doing something.
Mm-hmm.
Listen to their voice. I did this, I did that. You don't hear them talk about being.
Wow.
Being costs present. It costs something. You have to pause in order to be. Listening costs,
Wow.
because
Wow.
you have to discover what are the undercurrents. I talk about, and we talked about it last week, primary process and secondary process.
Mm-hmm.
Anytime you find yourself asking a whole lot of questions, you operate in secondary process. When it comes to being, you're trying to hear what's beneath these words.
Mm.
I heard you say, I'm okay, but say more about being okay. That takes time. That takes being.
Yeah.
And so I invite people who are listening, the gift you can really give to another. You don't have to be a chaplain. You don't have to be a pastor. You don't have to be a minister. But the gift you can give to another human being is your presence.
What's the difference between exploring and leading the client?
I had to laugh because I see so much of that. Leading the clients is what you think, what you know. It's all about you. Well, I hear you, and this, and sometimes when leading the client, you want to tell a story about what happened to you. Well, see, I understand this. No, you don't. You don't understand. Even if my mother died and your mother died, you don't understand, because my mother and I had a different relationship than you may have had with your mother.
Yeah.
So leading is doing a lot of talking, like you know so much. When you're being with a person, you come as an agnostic. I don't know anything. I come to hear. I want to hear. And that's what being is. Pulling yourself back and opening yourself as a reservoir to hear the story, to hear the echoes beneath the story. Explore. That's what explore. You go into a cave, a person start exploring and digging and looking beneath the surfaces in the caverns. They're trying to discover what's beneath.
Yeah.
And you will never get what's beneath the surface until you pause and just be.
Yeah.
Just
Yeah.
listen.
Yeah.
Just stop doing this. We can stop doing this. I'm serious. That's how you can tell. If you want to find out if you are doing or being, think about your last exchange. Who did most of the talking?
Mm.
If you did most of the talking, you were doing.
Wow. 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 That's a powerful thing. Here's a question. How often do church outreach visitation programs get in the way of chaplaincy ministries internal to hospital?
So how does church
Um,
programs get in the way of ministry to I think I know what he's saying.
okay.
I think sometime even in outreach programs, that's a lot about doing. Say for
Mhm.
instance, if we have an outreach program, I'm hoping I'm answering your question, Bishop Angel. If not, you can ask it a different way. I think sometime when it comes to outreach program, and it's good, we need those. We're about giving out maybe baby diapers or giving out food or giving out things that people need. But when do you pause and say, tell me, how are you doing?
Mm.
See, outreach program, they're good. We can't stop them because God wants us to do those. But if all you're doing is giving out things, but never pausing to check on how the person is doing, who's receiving from the church, then we're doing a lot of doing,
Yeah.
but we're not being.
Wow. Good doc. Ah, this time ran by so quickly. This I can't believe our time ran by so I can't believe I had so many more questions, but I guess this means that we got to come back another time. And
Be happy to come back.
I look forward to speaking with you again because this is so refreshing just
Mhm.
as hearing how as caregivers as pastors as chaplains how we can better serve individuals that God has placed within our sphere of ministry. And your expertise and the invaluable the experiences that you have gleaned over the years, certainly are very helpful to us. Now, I'm sure you want to give some final words. What are some of the things
Sure.
that you want us to leave with today?
Yeah. So a couple of things. As a matter of fact, I didn't want to forget them, so I wrote them down.
Sure.
Remember, if you can remember, every person you meet is a living book waiting to be read. And as you know, with any good book, it takes time to read it. You can't read. Sometimes you got to read it more than one time.
Yeah.
And the first page is rarely the whole story. Do
Mm,
not get stuck on the first page or the first word that someone says. Listen. And also remember that behavior is a cover. You see a person acting angry and upset all the time, that's a cover.
yeah.
It's a cover. The soul is the story. Get to the soul of the person. And the only way to get to the soul of a person is to pause and to listen to what's beyond that first word. People don't need answers. They just need you to witness. They need you to listen to what they have to say. And our calling, whether you are a minister or a chaplain or a lay person, is not to fix people. It's to walk the journey with them. They just need someone to walk with them. And presence is more important than trying to perform. Don't worry about trying to give quick answers or quick fixes. Pause and be with that person who may be suffering. And that's the best gift you can give them is your ability to listen and not to rush them. Those are my words I want to leave with you today. And thank you so much for coming and listening.
Thank you so much, Doc, and thanks to those who joined us on the live broadcast. For those who will watch, please go ahead, place your questions, your comments in the chat, and we certainly will respond to them. Thank you again, Doc. Looking forward to our next broadcast.
Thank
We
you.
will let you all know when that will be, so you can join with us and share with your friends. Go ahead, share, like, subscribe, so that others can see and we can know that you are joining us online. Thank you once again, and we'll see you next time.
Amen. Take care.